Antidepressants, there are so many options. Today we're comparing two big players, Exxua, the new kid on the block, and Prozac, the classic go-to. Which one's really best for treating depression? My name is Mattias Hartmann. I'm a board-certified psychiatric physician assistant, and I make videos on how to improve your mood. Exxua and Prozac are both used to treat major depressive disorder, but they go about it in different ways. Prozac has been the gold standard since the 80s, whereas Exxua has just arrived after decades of rejection. So we're comparing the new versus the old. Prozac is an SSRI, also known as a selective serotonin reuptake inhibitor, whereas Exxua is a newer class called azapirones that target a very specific serotonin receptor called 5-HT1A. So what does that mean for you? Let's dig deeper. Prozac works by blocking the reabsorption of serotonin, which increases the amount available in your brain, kind of like keeping the good feelings circulating longer. Exxua, however, is a 5-HT1A receptor agonist, meaning it directly activates this specific serotonin receptor. It's like pinpointing an exact spot that needs serotonin. Now let's talk about the side effects, because let's be honest, no one wants to deal with more problems while treating their depression. Prozac doesn't usually cause significant weight gain, which is a win for a lot of people. However, it can lead to sexual dysfunction, sleep disturbances, anxiety, and sometimes gastrointestinal problems like nausea. Another point, Prozac can sometimes make you feel activated or a little too jittery, especially in the early days of treatment. Although rare, Prozac can also lead to a serious condition called serotonin syndrome, where too much serotonin causes symptoms like fever, agitation, fast heart rate, and increased blood pressure. Exxua's biggest selling point is that it doesn't cause sexual dysfunction or weight gain. That's a big relief for many patients compared to some of the other antidepressants. However, it does come with some risks, especially QTc prolongation, which is a heart condition that requires regular monitoring with EKGs. You might also experience headaches, dizziness, or mild nausea, but these are relatively uncommon. Prozac might make you feel jittery or affect your sex drive, but Exxua skips these problems. The catch? Well, you'll need to monitor your heart, which can be a bit of a hassle. When it comes to effectiveness, Prozac has decades of data behind it. Clinical trials have shown that it works within 2 to 4 weeks for most people, with improvement in mood and reduced symptoms of anxiety. Exxua is still relatively new, but it has been shown to be effective in depression, with a number needed to treat of between 6 and 8 for response, and about 7 for remission. Response means symptoms go down by at least 50%, and remission means the symptoms go away almost completely. However, Exxua hasn't been around long enough to have the same depth of long-term data as Prozac. Now here's where it gets interesting. Exxua's approval wasn't easy. Among 74 trials reviewed by the FDA for approved antidepressants, 49% were negative, but for Exxua, 87% of the trials were negative, which is far higher than the usual failure rates of antidepressants. That means that while Exxua eventually got the FDA's green light based on a few well-conducted studies, it struggled to show consistent results in clinical trials. This kind of track record raises questions regarding its effectiveness. Prozac isn't just for depression, it's also FDA approved for panic disorder, obsessive compulsive disorder, and bulimia. It's a bit of a multitasker, helping a wide range of mental health issues. Exxua is newer and more focused. It's being studied for other uses like generalized anxiety disorder and sexual dysfunction, but for now its main use is depression. Because of its heart risk, it's important to get regular heart checks if you're using it, which can feel like a bit of a hassle. Subscribe to the channel if you'd like to see more videos like this. If you enjoyed this video, check out this video next, where I explain why you shouldn't be afraid to take antidepressants and how long you should continue taking them once you've started. I'll see you over there.